I get the privilege to welcome Kreizenbeck to the room. Karma is someone I've gotten to work with quite a lot over the last 6 months, and I say genuinely learn from and appreciate both her speaking today and then the work the past 6 months together. So welcome to Karma. Thank you.
Thank you. I'm really excited to have the opportunity to talk to you today about our collaboration with HICOR. I mean, we are HICOR with LabKey. See, I feel like you're so much a part of our family now. I'm going to talk today about how we're using data transparency to improve cancer care and our collaboration with LabKey on that. So I work at HICOR, which is an institute at Fred Hutchinson Cancer Research Center, and it was founded in 2012 with a complementary goal of improving the effectiveness of cancer care delivery. It's borders on health economics and cancer care delivery research, and is directed by Scott Ramsey, who's a health economist and general internist, as well as Gary Lyman, who is a breast cancer oncologist and a national leader in cancer policy. And really, thank you. It was really founded out of the idea that the way that cancer care is delivered right now in the United States is actually a threat to Fred Hutch's mission of eliminating cancer as the cause of suffering. And I'll talk a little bit more about that. And our collaboration with LabKey on this has been to build a tool that enables the sharing of data around cancer care delivery. So called HICOR IQ. We're very proud of this. So just a little background. So why HICOR and why now? Patients are put on the hook for more of the costs of cancer care than ever before, and the cancer care costs are rising. And there's a new phrase around this called financial toxicity. There's a lot of literature around toxicity related to cancer treatment, and financial toxicity is another potential side effect. And there's also great variability in the way that care is delivered. So you've probably seen something similar to this in New York Times, Washington Post. Healthcare costs are rising. The cancer costs are rising way beyond any other area, and that's related both to the pricing of drugs and to other high-tech things like imaging, et cetera. At HICOR, we do a lot of linking of data, and so we linked the cancer registry, which is housed at Fred Hutchinson Cancer Research Center and looks at cancer patients in Western Washington, with the federal bankruptcy court records to look at kind of the extreme event of financial distress for cancer patients. And we found that cancer patients were twice as likely to go bankrupt than healthy matched controls. And depending on the cancer type, it was even more dramatic in some areas. And that's, again, an extreme case of distress. There's data we've done in our group to show that many patients have other varying forms of distress before you get to bankruptcy. There's also extreme variation in the quality of care. So we looked at adherence to a guideline around prostate imaging around diagnosis, and found that, so each dot here represents clinics in the region, and we looked at the adherence to the guideline as well as the costs 2 months before and after diagnosis. And you can see that it's all over the place. The costs and the adherence to guidelines varies dramatically, and this is in our region here in Western Washington. So HICOR is really looking at a data-driven community engagement model to improve care. And the way we work, we have this fancy little wheel that we like to show at every presentation we give, is that we first like to characterize cancer care, and we do that by linking different databases. Then we work with the community to prioritize areas for improvement. We design programs, actual cancer care delivery research programs, to test the interventions. We evaluate the outcomes, and then we keep going in the circle. So I'm going to talk today about kind of the first phase, how we characterize oncology care. And really the goal here is to put data in the hands of the decision makers around healthcare. And one of the challenges in working in this space is that there's no trusted group to do this. The insurers are skeptical of data provided by the clinics are skeptical of data provided by the insurers, and the patients don't know how to make sense of some of the complicated guidelines and data that's presented to them. So we've been working on this community process to improve care. In our initial stages, there are several metrics or guidelines that were identified either at a national level or by our community stakeholders across the continuum of care. And we, as a team, decided to measure adherence for this region to these guidelines. Ideally, when you're putting together the story of adherence to guidelines or a patient's path through the cancer care continuum, you would have a variety of data sources. The cancer registry provides this information on kind of the pathological outcomes for your first treatment, stage, tumor type, etc. Health insurance claims give utilization, so we know what services were paid for a patient. We don't know the clinical rationale why a service was ordered. EMR would give us that, the clinical rationale and results. And then ideally, and this is something Nola will be talking about in the next presentation, you would have patient-reported outcomes. You would know the quality of life and the patient experience, and perhaps out-of-pocket costs and other indicators of financial distress. So you can see then that you can apply the metrics to these different stages of care and be able to give some determination of how well care is being delivered. What we have right now in HICOR IQ is a claims versus registry or plus registry data source. So we've received healthcare claims from the two major private insurers in the region, Regence and Premera. We linked those with the cancer registry. And then we have about 66,000 cancer patients that we're able to do analysis on. We're in process of getting data from the state, from Medicaid and the public employee benefits, and working not as successfully to get Medicare data because that represents a larger population of cancer. So what we've done with this data is collaborate with LabKey to create a tool so that we can actually allow our partners to look at how they're doing relative to these guidelines. And we call that HICOR IQ. Actually, LabKey came up with the name. We thank them for that as well. And we launched our first beta version of this at a summit in March with all of our partners. We had health insurance, policymakers, representatives from clinics, patients, etc. And we gave them access to this tool. And it's basically, in its initial state, provides interactive reports on regional performance, and then we're working towards exploration of regional and clinic level variation in metrics. So people are allowed to log in and look at kind of a list of reports. And this right now is, oh, thank you. Sorry about that. The metrics that we have in there right now, and these are all ones that were either decided on by the community or are part of national recommendations. And you can click through and say, well, I'm really interested in how well we're doing on, or how well the region's doing in colony stimulating factor prescribing. And this is a drug that is one of the most misprescribed drugs in cancer care. It's a supportive care drug. And it's not supposed to be prescribed in low risk, and there's insufficient data in intermediate risk. So here you can see, well, it's still being prescribed in low risk, and there's some in intermediate risk, but well, how are we doing in breast cancer, where there's a lot of intermediate risk regimens? So you can click through and say, I want to look at the breast cancer. And you'll see here the use in breast cancer patients. The one thing that's notable about the tool right now is that for privacy concerns, we have to protect certain cell sizes. So you have the ability to know what is being excluded as you go through the filters. So all of our partners are dying to see this information for their clinic or for their health insurance population. It's really interesting to see the regional averages. It's really interesting to see, performance. But every single person wants to know, well, but how am I doing, and how far down can I dig into that? And that's what we're working towards. We're working towards building this sort of neutral, trusted, accessible. The one thing that we hear over and over again is we need something that's not just for statisticians. So while the goal is to use this for cancer care delivery research, and we anticipate one of our major users will be researchers, it is also to be used by community members. And ultimately, we hope to have some version of a tool that could be used by patients. So going back to how we work, we have kind of done some background work on this. So some of this is not, it's the pre-work to the tool. And we have actually prioritized areas for improvement, delivered the results of this at a clinic level to our partner clinics. So in December of 2014, while we're simultaneously building out HICOR IQ, we actually gave them a paper version of a report that described adherence across the region. And privately, a big key to this is doing a stepwise process with our partners. This is very sensitive, how this information is shared. You're one, dealing with competing hospitals, and two, dealing with clinics and insurers who are negotiating contracts. And so how this data is used, how we roll it out is really important. And so we actually have a steering committee that helps advise us, and everyone agrees that we're moving towards data transparency. They just want to understand the steps that we're going to take to get there. So we released this report, and then we gave everyone their own individual level adherence. And the most striking thing about this for us was that there was no clinic that was consistently above average, and that was no clinic that was consistently below. So there was an opportunity to learn for each other. In some ways, this was a huge advantage to us because it created an opportunity for people to feel at ease in learning from their peers and thinking about this as an opportunity to improve rather than some punitive way of reporting out on metrics. So where are we going? As I said, everyone is dying to see their clinic level adherence. So our next phase is to actually build out so that when you log in, you can see, I'm Primera, and I want to see the studies that I'm partnering with HICOR IQ on, or HICOR on, and I want to see my population relative to a variety of different metrics. Right now, in our current database, we have the registry and the claims, and our goal is to start incorporating EMR and PROs. And actually, Nola Klimfos is going to talk about some of the work we're doing with that in Empower. She's the next. Now, it's much easier to do claims and registry. The EMR is a huge undertaking, and we're really thinking about how we can selectively incorporate EMR, because every person I've ever talked to who's tried to undertake a project like this has said, it's a huge mistake. Don't do it. It'll never work. But we're hopeful that there is some version of this that will be successful for our tool. So we're working with LabKey on figuring that out. And our goals are really, because it is to be used by community members as well as researchers, is to make it intuitive and actionable. So everyone wants to know when they log in, well, it's great that you have this huge list of metrics, but how can I actually act on that? Where is a decision point that could be made differently? And so figuring out how we create reports that are actionable and that provide enough data that they can go back to their insurance company or their clinic and know where to dig in, and where we provide the signal. To be flexible and adaptable. Guidelines change, quality metrics change. How can we make it possible to add those in easily and report out on things that are meaningful to each of our users. And most important is, how do we protect this data? And we've gotten as far as we have because we've been a trusted group. LabKey is trusted, Fred Hutch is trusted, but we have to maintain that in the most rigorous way possible as we move forward. So it's been a really great partnership. We have had tremendous community response to this initial tool, and people are clamoring to get the next version. We use both the kind of out-of-the-box tool as well as some custom development. Throughout the process, LabKey's worked with us on doing stakeholder interviews at the very beginning when we first kind of had some idea of what we wanted to build, but we weren't exactly sure, and we described it in 15 different ways. They sat through a series of interviews with our research partners and others to try to pin down what it is we were talking about. They've been a tremendous partner along the way. And then more recently, we've done another set of interviews with our stakeholders as we build out HICOR IQ. And they've also collaborated with us on data visualization. So we have a staff scientist, Catherine Richards, who has some specialty in data visualization. She's worked very closely with LabKey on that as well, and it's been a tremendous partnership. So we're really excited about our ability to use this tool to help change healthcare. And that's kind of my quick overview of what we're doing. If you have any technical questions, I'm probably not the best person to answer them. But if you have more general questions about what we're doing, I'm happy to answer those. So thank you.
All right, great. Thank you, Karma.